This is the recording of the first online seminar of the Committee of Practice on Evidence-Based Planning and Budgeting, supported by Harmonisation for Health in Africa. Welcome Netsanet, welcome to all, and Netsanet, the floor is yours.
Thank you very much, David, for organizing this. And I would also like to thank all who joined this afternoon, taking time from their work. Highly appreciated. What I did is I put together very few slides, I think about 8, 9. And I would also like to point out that there are very good sources, including, actual country applications. One in the World Bank, we have a dedicated website for this. OECD also, they do have quite a rich resource on physical space, and generally linking it with budgeting, MTF, and so on. IMF as well is a very good source to further explore this area. So something to keep in mind, as we continue to discuss this field. Now, if we go to the first slide, the definition of physical space. As you can see, this is something which is highly linked with IMF most of the time, and most probably that's where we originally took it. And it is defined as availability of budgetary room that allows a government to provide resources for its desired purpose without any prejudice to the sustainability of a government's financial position. This is the original Peter Heller's definition in 2005. And since its initial conception, physical space is highly linked with sustainability, physical sustainability. Trying to look into implications of current commitments to spend, to invest, and its implication for future, particularly recurrent cost implications. And that's usually the case with sectors that are usually perceived as non-investment sectors. So every time discussing physical space, one needs to look into sustainability. And again, before we move to the sector-specific discussion, at a macro level, at the national level, the possible sources to generate physical space, to create more budgetary room, could include taxes, including, expanding tax base or introducing new taxes or improving efficiency in the tax administration. Or it could go, another source could be a reallocation of resources within, inter-sectoral reallocation from lower priority to high priority sectors, etc. Another source is borrowing, both internally and externally. Again, the level of debt is something that a macroeconomist or Minister of Finance, national banks looks into when using this source to create physical space or to pay for investments. A fourth potential source for creating physical space is printing money. And again, it's a delicate instrument to not to result or not to lead into inflationary situations. Another is grants, mainly external grants, aid, and those also could be a potential source to create physical space in any particular country. So generally, overall speaking, these are the sources that countries' Ministry of Finance look to create physical space or budgetary room to finance their expenditures. Now, I would like just to point out a couple of important points. First, when we say physical, the whole discussion is about government resources or public resources, mainly expenditures. So physical space basically deals with the domain of government, public resources. Second, until recently, it was not common to restrict the view of physical space to one particular sector. Usually, a physical space analysis was conducted as a macro physical framework exercise. And the reason is, in any budgeting process, the resource that's made available to one sector depends on a number of factors that goes beyond the sector, and which makes doing a sector-specific exercise analysis a bit challenging. For instance, the budget that's allocated for health is partly dependent on the government's overall fiscal policies and the demand for competing sectors. In the end, Ministry of Finance has to allocate, or the national government or subnational government has to allocate resources to competing sectors. And third is, it also depends on spillover effects from one sector to another. Meaning, if we take the example of health, our budgets could be complemented by, investment in the water sector, for instance, investment in the sanitation and hygiene if these are outside health, or it could be complemented by, other sectors like agriculture or education and so on. So these are making physical space in a particular sector needs to really go beyond the sector for the large part of the analysis. So something to keep in mind. So the size of the health budget is the result of a set of political decisions on the allocation of public resources between competing priorities. So just to keep that in mind. Now, why do we need a sector-specific physical space assessment? One reason is consideration about potential to increase public expenditure on health need to be placed in context of government's fiscal position, for instance. And this could apply for any other sector. It could be the same for education, agriculture, so doing a sector-specific fiscal assessment will give, a good base to look into the fiscal implications. And the second reason is lack of adequate and sustained level of resources is often identified as biggest constraint to achieving health outcomes, for instance. So one needs to do a specific, more focused, detailed analysis on what are the potential sources to generate financing to scale up, to implement, to increase coverage in health and to advance towards the MDGs. A third reason could be spending decisions in health sector have an important influence on government fiscal position. And for instance, if a country, a health sector in a country wants to recruit massive number of, let's say, community health workers, paid community health workers, certainly this will have implication on the macro fiscal framework, on the whole recurrent wage bill, and there's a need to explore and look into its implication to the overall fiscal health. And a fourth point is health sector policy and expenditure decision will therefore influence fiscal space and vice versa. So just again, why are we talking about health specific fiscal space assessment? These are some of the points to highlight. Now, coming to health, fiscal space for health is defined as availability of budgetary room or resource for increasing public spending for health without jeopardizing macroeconomic stability and basically financial sustainability. This was defined by IJ in 2010. And some fine-tuning on potential sources to generate fiscal space for health. First is really to look into the macro economic conditions. With growth, the overall budget envelope, resource envelope of a country could increase, and with that, the share of health will increase. So, even if we are doing a fiscal space analysis just for health, there is a need to look into the macroeconomic conditions. So analysis into macroeconomic conditions is important. Second is focusing on extent to which health might be reprioritized within the government budget. And this directly goes into, at least in Africa, into the usual argument for the 15% Abuja declaration. With the 15%, what it implies is government or Ministry of Finance will allocate more to health, which basically means they will reallocate from another sector to health, because the resource envelope is limited. So increasing health to 10% to 12% implies taking that 2% from another sector. So one has to look into, to the extent this reprioritization is possible within the government budget. A third is examining pros and cons of sector-specific means to raising resources. And I think here we do have some examples. Some countries introduce sin tax for alcohol or beverage or tobacco. Some countries introduce earmarked tax. For instance, Ghana has, as part of the VAT, 2.5% of the VAT earmarked to finance the health insurance. So this could be also sources that could be explored to see, examined to see what can be generated. A fourth source is evaluating the use of sector-specific external grants. And here's the whole issue of, predictability and sustainability of external external grants needs to be discussed, particularly in light of the whole harmonization and alignment issues. And a fifth part is efficiency gain within the sector. How the existing resource is being utilized, and if there are ways and rooms to improve on the efficiency of the current present sector expenditures. So the first three potential sources, as we discussed, they are really outside the domain of the health sector. At the same time, while doing physical space analysis for health, we need to go into that analysis. We cannot do just a physical space analysis without looking into potentials of growth, potentials of domestic revenues, and potentials for reprioritization within the different sectors. And the last two, which are external grants to health and efficiency gains, are more or less within the domain of the health sector. And I think any physical space analysis assessment needs to really dig into these two areas deeper. Again, why physical space for health? Physical space analysis is one tool to assess, monitor, or predict the sources and level of public resources available for the health sector. And it's a forward-looking analysis. So a question that could be answered is, given well-defined needs, what are the prospects for increasing government spending for health in the short to medium term, usually in a 3-5 year span? B, to inform policy dialogue within government and other stakeholders. For instance, if a country wishes to pursue and push for a universal coverage, there is really a need to look into how that universal coverage policy is going to be financed, which in turn will require to look into possible sources and making projections and analysis. Another policy point, for instance, could be a country which today charges user fees, and if it pursues to abolish user fees in the coming years, again, it will be important to explore how that lost revenue to the sector will be replaced or complemented. Another is efficiency measures or efficiency gains. It could look into both allocative and technical efficiencies. I think recently in Nepal, they did mostly a physical space analysis, which is more exploring the options of creating physical space through efficiency gains. So again, the point here is depending on the policy issues, and these policy issues will vary from country to country, physical space analysis can provide evidence and projected resource generation, and to complement any financing gap analysis. And the policy issues could be more, and they could vary from country to country. The third point that I want to highlight is physical space for health could complement a public expenditure review. For instance, while doing health sector public expenditure review, one could find out, the sector is highly underfunded, after doing all kinds of benchmarking, comparing that particular country with other similar economies or similar, countries with the same burden of disease and so on, and they could come up with a recommendation, or a conclusion saying the sector is underfunded. And that's where PR, probably public expenditure review, stops. But with the physical space analysis, one can take that conclusion further and look into possible sources to finance and the implication of each on the macroeconomic physical health. Same way, a physical space for health could complement the medium-term expenditure framework exercise, as medium-term expenditure framework is a multi-year budgeting tool, and as it is a forward-looking tool, it can be complemented with, a deeper analysis with physical space. And this is, I think, my last slide. Some critical questions, to pause while conducting or while planning to conduct a physical space assessment. First, there's a need to be really clear on what are the reasons that drive the need for increased physical space for health in the country. Why? Are we introducing any, new service package, or, for instance, you have done a 5-year strategic plan and you have a funding gap, and then you wanted to look into how to finance that funding gap. So there is a need to be clear at the very start of this exercise to know why we are doing physical space, or why do we need more. Second, with that analysis, the aim is really to see what are the potentials for generating additional physical space. So this is by way of summary, looking into growth, domestic revenue, reallocation, grants, and so on. And a final point is a physical space analysis needs to discuss in depth the most viable options from these, possible sources for increasing physical space, and the pros and cons related to each option. And that is, I think, what I have just to as input for our discussion. Thank you.